Kenyan teacher is stranded in India, fighting for her life, because a new government health system can't pay her bills. This is Kenya News Update today. Coming up, you'll discover how a promise of universal health care turned into a nightmare for one family, and what it reveals about a system with a 116 billion shilling hole. Meet Jane, a teacher from Baringo Central, a mother, an educator. 3 months ago, she traveled to India for a last chance treatment, a bone marrow transplant for acute myeloid leukemia. Her family believed the new Social Health Authority, or SHA, would cover it, but here's the twist. The system designed to save her has left her abandoned. She's been stuck there for 90 days, watching her life drain away, not just from cancer, but from bureaucratic paralysis. Her husband says they exhausted everything. They believed transitioning from their teacher's medical cover would end their nightmare. Instead, it created a new one. They've already spent an additional 5 million shillings on chemotherapy, travel, and procedures. Money that's gone, hope that's fading. But here's what nobody's talking about. The SHA has a 500,000 shilling payout cap for overseas treatment. Her transplant alone costs 5 million. That's a 4.5 million shilling gap her family must bridge. And the clock is ticking. And then something shocking happened. Hospitals in India and Turkey are now demanding upfront payments from all Kenyan patients. Why? Because of prior unpaid claims. The SHA hasn't paid its bills. So now even if you have approval, you pay cash. For a teacher's family, that's an impossible mountain. Here's the part that will blow your mind. The SHA CEO, Dr. Mercy Ganji, admits the system is, in her words, paralyzed. The onboarding process for foreign hospitals isn't complete. She says it should be done by the end of February. But for Jane, February might be too late. This isn't just one story. This is a symptom. The SHA is grappling with a 116 billion shilling funding deficit. Compliance rates are at a shocking 18%. Payment delays are causing high claim rejections. There's growing public distrust. Providers say the SHA tariffs don't even cover the cost of medicine. Some are withdrawing. The Auditor General has flagged a disorderly rollout. So we have a teacher dying in a foreign hospital, a system bleeding money, and a public losing faith. Some say this is just teething problems for a new system. Others say it's a catastrophic failure of governance. But here's the unanswered question. If the system can't save a teacher who paid into it, who can it save? The implications are terrifying. This controversy touches every Kenyan expecting healthcare. The tension is clear, the promise of universal coverage versus the reality of a broken rollout. But if a dedicated public servant can't get help, what hope is there for the informal sector? The family's friends are begging the government to fast-track the process and increase the capped amount. But with a 116 billion shilling deficit, where will that money come from? Every second of delay is a sentence for patients like Jane. We started with a teacher stranded in India, fighting a system as hard as her disease. This is Kenya News Update today. Do you think the Social Health Authority can be fixed, or is it fundamentally flawed? Drop your take in the comments. Subscribe for more breaking news that impacts your life.